Hello and thank you so much for joining us. I'm Anthony Robart. Whether you're watching on TV or online, we are waiting for the latest update from Prime Minister Justin Trudeau. He is expected to walk out of Rideau Cottage, his home in Ottawa, where he continues to self-isolate. It's expected in about 15 minutes. We'll bring that to you live the moment it happens. So the Prime Minister says overall, he is proud of Canadians as cases in other countries continue to soar. Let's take a closer look at the bigger picture. There are now more than 800,000 confirmed cases of COVID-19 around the world, a staggering number. And the number of cases in the U.S. continues to surge, where now more than 140,000 people in cases have been confirmed. In Canada, more than 7,500 people have tested positive. Let's get a closer look at Canadian numbers, and here's where the infection numbers stand today. Quebec remains the hot spot. There you see on the board, more than 3,400 cases, 25 deaths. In Ontario, a total of 1,966 confirmed cases, 33 deaths. West, in British Columbia, 970 confirmed cases and 19 deaths. In total, 89 people have died in this country. Now, the devastation, of course, continues at an Ontario nursing home that has been ravaged by the pandemic. Global News has now confirmed 3 more deaths related to the facility, bringing the number of fatalities to 12. The medical director at Pinecrest Nursing Home in Bobcaygeon, this is northeast of Toronto in the Kawartha Lakes region, says she is devastated, describing the facility as a war zone. Now, Pinecrest is home to 65 residents. More than a third of its staff have also tested positive for COVID-19, several others exhibiting symptoms. Those staff members have been sent home. And we are expecting to learn a little bit more today about how much the emergency wage subsidy program exactly will work and how much it will cost you, the taxpayer. The Prime Minister says Ottawa will provide a 75% subsidy on wages to businesses that have lost at least 30% of their revenue. The program, incidentally, was not included in the $107 billion emergency aid package that was approved by Parliament last week. Finance Minister Bill Morneau and Small Business Minister Mary Ng are expected to provide more details later today. All right, let's bring in Abigail Beatman, who is in Ottawa, and joining us now. We have a number of reporters standing by, Mercedes Stevenson as well, and Raquel Fletcher in Quebec City. But Abigail, first, let's begin with you, and we want to begin with the wage subsidy. We got some more information yesterday. But of course, Canadians, business owners, hanging on every word from the Prime Minister and the Finance Minister, what the details are. Still a lot of questions, especially regarding enforcement. Do we have any sense of what we can expect today?
Well, there are a lot of questions, and they came flying as soon as the Prime Minister gave that additional information yesterday. The big standout point was that this 75% wage subsidy, it doesn't matter how big your business is. It applies to businesses of all sizes as long as that business has seen a 30% drop or more in revenue because of COVID-19. So the biggest question that I was hearing from people interested in applying and getting this help was, how do we do it? And that's a big question. The government had a plan in place when it was a 10% wage subsidy, 75%. Obviously, we are talking about a huge amount of money. And so we are hoping to find out today how businesses go about doing this. Also, you know, the Prime Minister said if you laid somebody off recently, you should go ahead and rehire them because of this wage subsidy. But some businesses don't know whether to go ahead and do that since there are few details out there. But that is the advice from the Prime Minister because this wage subsidy will be backdated to the middle of March. So a lot of business owners have a lot of questions. You also mentioned enforcement. So the Prime Minister said there would be very strict consequences for anybody who tried to game the system, so to speak, take advantage of that. We don't know what those consequences are or how they'll be enforced. But as you say, expecting to hear those finer details later today from the Finance Minister and Small Business Minister. The Prime Minister expected to speak more about protective equipment.
Yeah, and extending on that, Abigail, you know, all along the PM has said, if you need help, the government is here for you. Tomorrow, April 1st, look, rent is due, mortgages are due, and the April Fool's joke for so many is that they don't have a paycheck to even pay for this. There have been calls to cancel, delay it, whatever. Any expectation on that front?
Yeah, it's certainly not funny at all for so many people who are in this situation. We've seen some moves provincially to help, especially renters with rent due. That is a big question here. We've seen the strongest moves came in BC that was offering a wage subsidy program, freezing evictions, freezing rent increases. We saw some moves in Ontario too, in terms of evictions, but we haven't really heard much from the feds about that, about renters. And with this April 1st deadline looming, remember, Ottawa's promising two different kinds of help for people who are losing money here. There's what we spoke about, which is the wage subsidy, which comes through the employer. And then there's the direct emergency response benefit that is separate and it can give up to $2,000 a month for people who have lost income. That portal to get that money doesn't even open until April 6th, and then the money is supposed to flow 10 days after that. My point here is that nobody is going to be seeing help by April 1st. We've heard calls for landlords to work with their tenants if they can't pay the rent, but nothing definitive here to help these people who are facing a very real deadline tomorrow.
Yeah, we're getting drip, drip, drip of some information, but of course the anxiety flooding in for so many people across this country. I want to talk about also the pressing issue concerning frontline workers, and that has to do with personal protective equipment. Where are we? Where is the country on addressing what many healthcare workers are saying is a shortage and really a dire situation?
Well, that's right. We hear from healthcare workers. We hear about hospitals that are rationing masks and other personal protective equipment. If you haven't heard that term, PPE, expect to be hearing it more and more. Personal protective equipment, things like gloves and gowns and masks that are so critical to keeping frontline healthcare workers safe. We heard from the Prime Minister last week that millions of items were on the way. We also know a lot of that is coming from China. Some of that has arrived already, but we're expecting to hear more from the Prime Minister about procurement and about the state of things involving personal protective equipment. We hear different things across the country, different situations across the country, and also, you hear concerns from frontline workers that aren't necessarily in hospitals as well. I know, we ran a story over the weekend about a situation in Montreal where they're setting up day shelters for homeless people, seeing 1,000 homeless people a day. They've been asking public health every day for weeks to get masks and other gear for those workers, and they've heard nothing. So I know there are lots of stories like that right across the country, hoping to get a better sense of where things stand. I talked about gear coming from China. The other big story here is the number of companies that are looking to step up and help, and individuals who are looking to step up and help. How quickly can factories turn over to produce more equipment? How many factories do we have willing to do that? We hear a lot of these stories. I'm not sure that we have a comprehensive picture yet of where things stand.
I want to pivot to the issue with long-term care homes. We just got confirmation that there's been another death at the Pinecrest home. We reported 12, now another death. This is a volunteer. So it really underscores the greater issue, doesn't it, for long-term care home and protecting our seniors. What do we hear in terms of any protection measures? I know Ontario, for example, has an emergency order in place, but what is being done at a federal level?
That's right. We haven't heard a lot from the federal level about long-term care homes, but important to note, of course, this is a provincial responsibility. Healthcare is a provincial responsibility, so expect to hear from each province on that first. And you mentioned what Ontario was talking about yesterday. Doug Ford, the premier, referring to an iron ring to protect people in these long-term care homes. His iron ring involves $243 million for what he refers to as better screening, better cleaning, perhaps increased capacity. But you see what happened in this awful example in Bobcaygeon, Ontario, at this nursing home. 12 residents died. Well, there's only 65 beds in that home. And yesterday, the medical director was telling us that at least 35 other people are sick and 24 staff. So it can really spread quickly in that kind of environment.
Yeah, it is an absolutely devastating situation in Bobcaygeon, but we're hearing at many long-term care homes across the country, and obviously, as you mentioned, a hotspot for this pandemic. If you're just joining us at home, we are awaiting the Prime Minister, his daily address from his home at Rideau Cottage. This is where he remains in self-isolation. He will walk down the steps and walk to the podium. We'll bring that to you the moment he begins speaking. Let's stay in Ottawa, in fact, to the nation's capital, and connect with our Ottawa Bureau Chief, Mercedes Stevenson, who is at home, but obviously working incredibly hard in this situation and under these circumstances. Mercedes, thank you so much for joining us. A lot of questions as well. We heard about the Canadian Armed Forces and the question of mobilization. They are effectively always in a state of readiness. But what does it mean for the armed forces and really their response measure when it comes to this pandemic in this country?
So they've been preparing for this for some weeks now. And in fact, some people are already essentially in sequestration. More are going to be sequestered soon. In fact, 2 entire ship's crews. The crew of the HMCS Ville de Quebec, which is a big frigate that's got an over 200-person crew, as well as the HMCS Moncton, that's a coastal patrol ship, a smaller crew, around 30 to 40 people on that one. And they're going to put them in civilian hotels. They won't be allowed to have contact with other people or to leave to ensure that they don't have COVID-19. When troops come back from overseas and a number are being brought home off operations, they are being isolated for 14 days like the rest of Canadians. But it's particularly important because these are troops that I'm being told could be turned around and sent right back out. And they don't want to send these troops into communities and have them carrying COVID-19. They also will be testing all troops who are heading to vulnerable communities in particular. When you're talking about some of the communities up north or isolated communities, Indigenous communities, they need to make sure that they're not the ones bringing it in. In terms of the scale of what they're looking at doing, they're talking about deploying up to 24,000 troops. That would be the largest domestic peacetime deployment of the Canadian military in our history. The biggest right now was the ice storm, and that was 15,000 troops. So we're talking about 9,000 troops more than that. Literally all hands on deck, as a senior military source said to me. There's a range, though, Anthony, of what they could be doing. It could be much smaller. It could simply be medical help. It could be things like the logistics, or it could be as serious as having the military out helping to enforce quarantine orders. There's a whole range of things here, but there's sort of 3 big priorities for them. Number 1, to have the ability to help the government enforce quarantine if they need to do that and to check things. Number 2, to be able to help vulnerable communities. And number 3, to be able to help cities and provinces. Now, there have been no official requests from provinces for help at this time. But we do know that 2 Manitoba First Nations communities have asked, one near Cross Lake, one near Norway House, via letters to the Minister of National Defence, asking him to build a military hospital. They're very concerned because they're a remote area and they don't have a hospital nearby. They don't have any COVID-19 there yet, but they're very worried about it coming there. So this is some of the stuff the military is looking at. We don't have an indication the military is considering that request that went to the minister. Typically, there's a very specific way that those requests have to come in, but I can tell you that military planners are actually sitting in these provincial meetings, the emergency management meetings. They're listening to what's going on. They're providing information about what they would be able to provide, and the provinces are able sort of to unofficially say, hey, what if we asked you to do this? And they can say, yes, absolutely, we could do that, or no, we simply don't have that capability or that equipment. So there is a constant dialogue going on behind the scenes, even though there's not an official ask coming out at this point, although you do have those 2 official asks from those reserves.
Well, either way, potentially a massive mobilization. Let's talk about the Keystone XL Pipeline, certainly an issue close to home for a lot of people in this country. And we're hearing that construction will go ahead. What more do we know on that?
Yeah, so at this point, the plan is for construction to go ahead, and I've heard concerns on 2 sides. I've heard concerns about the fact that you could have COVID-19 coming in on workers who are coming into some of the communities along the pipeline. I've also heard concerns that those protesting the pipeline could bring it in. But at this point, there is a plan for that to continue. Construction is still considered to be an essential service in provinces. Federally, there has been no ruling that has come down to say that people can't do construction. The government considers that a pretty vital national project. And so, although it's a very controversial one, but at this point, the plan is for it to continue.
Mercedes Stevenson, we'll touch base later on. Thank you so much. That's our Ottawa Bureau Chief joining us from Ottawa. Now, of course, Quebec remains the hotspot for this country in terms of COVID-19 cases, though the province said recently the number appears to be stabilizing. Joining us now from Quebec City is Raquel Fletcher. And Raquel, thank you so much for joining us. The provincial government giving us at least some insight into potential scenarios based on their projections. It was stabilizing. Has that changed?
Well, thanks, Anthony. Yes, yesterday, public health authorities and their experts gave the Press Tribune some insight into some of the projections that they're looking at. They gave us at least 3 scenarios. It's interesting. Now, we know that before the measures, the social distancing measures, people who were infected they had the potential to infect multiple people. What we're looking at now is, since those measures have been in place, they're looking at rates of infection between 0.4 and 0.6 and 0.8. What does that mean? Well, it means that for every 10 people who are infected, they could potentially infect 4 to 8 more people. So significantly reduced. In terms of what that means for how long we're going to be in this sort of self-isolation situation here, it could be anywhere between 30 days since the beginning of those measures and 85 days. So, if you take it like that, it's a wide range of possibilities. They also mentioned, though, that doesn't mean, even if we get to the other side of the curve there, that doesn't mean that they're going to loosen all of the measures all at once. They're probably going to keep a significant number of the measures in place in order to prevent another increase of new cases, another increase of infections. So when can we return to normal? That was the main question we were asking public health authorities yesterday. The answer is it might be a long time. It might be that we have to wait until a vaccine is found. So definitely the public health authorities are looking at all sorts of scenarios, worst case scenario.
Raquel, I'm going to have to jump in.
It could be
Raquel Fletcher joining us from Quebec City. I'm going to jump in. Prime Minister Trudeau is speaking now. Let's listen in.
About the Ukrainian International Airlines tragedy that took so many innocent lives earlier this year. Even as we face this new crisis, families and loved ones continue to grieve and seek answers. I want to assure them and all Canadians that we have been working hard to get accountability and justice, even as we fight this pandemic. At the same time, we've also been developing a strategy with our other international partners to make sure that such a tragedy never happens again. Today, I'm appointing the Honourable Ralph Goodale as my special advisor for Canada's ongoing response to the downing of Flight 752. With his decades of extraordinary service to Canada, including as Minister of Public Safety, Ralph has the right expertise to guide our response to this air disaster and provide recommendations for best practices going forward. He will also continue to push to see families properly compensated. The second thing I want to do is share a story with you. A few weeks ago, Dave Caputo, the owner of a startup in TrustCore in the Waterloo region, called a meeting with his employees. With mounting concerns around COVID-19, Dave asked his team how they could repurpose their building materials factory to make products hospitals needed. A few days later, they had 4 prototypes drawn up. They decided to make large panels, which hospitals could use to subdivide rooms and isolate people with COVID-19 from other patients. Well, on Monday, panels made of fully recycled materials were delivered at no cost to several hospitals in the region, including Grand River, St. Mary's, and Guelph General Hospital. Dave and his team showed what Canadians do in difficult times. We don't back down from a challenge. We roll up our sleeves and we get to work. I know that this pandemic has been incredibly challenging for people right across the country, but we're also seeing the best of what it means to be Canadian. From coast to coast to coast, businesses are retooling to produce face shields, ventilators, hand sanitizers, and other supplies our healthcare professionals need. To make it easier for companies to help out during this critical time, we launched Canada's plan to mobilize industry to fight COVID-19 a little over a week ago. In the time since, we've spoken directly to almost 3,000 companies who've reached out to offer their help. Before we go any further, I want to thank all the owners and entrepreneurs and managers who've answered our call to action. This vital support comes at a critical time. And the way you looked around and said, not how can I keep myself safe, but how can I keep myself and my employees safe and help out in this critical time, is a real sign of leadership and a sign of what Canadians do best. In tough times, we pull together, we're there for each other, we put up our hands and we ask, how can we help? I also want, in the same vein, to thank everyone who's making, shipping, and delivering these products. People who work on the manufacturing sector and in terms of getting people the items they need are on the front lines of this fight. Our country needs you through these tough times, and we thank you deeply for everything you do.
When we announced the Canadian plan to mobilize the industry against COVID-19, we said that we were on the point of signing agreements with Spartan Bioscience and other companies of their ilk. Today, we're announcing the signing of supply contracts with the 3 Canadian companies to manufacture medical equipment, respirators, surgical masks, and tests. I'd like to point to the work done by Minister Baines, who's played a leading role in concluding these agreements. We've also signed letters of intent with 5 other companies, Precision Biomonitoring, Fluid Energy Group, Irving Oil, Calco Group, and Stanfields. By mobilizing industry, we'll be able to produce here at home the goods that our healthcare professionals need to protect their own health, to treat patients suffering from COVID-19 and to break the spread of the virus as well.
Our plan to mobilize industry, we said that we were close to reaching agreements with Thornhill Medical, Medicom, and Spartan Bioscience. Today, we're announcing that we have moved forward with contracts with these 3 Canadian companies to make medical supplies such as ventilators, surgical masks, and test kits. I want to recognize the great work Minister Baines has done to make this happen. We've also signed letters of intent with 5 other companies: Precision Biomonitoring, Fluid Energy Group, Irving Oil, Calco Group, and Stanfields. We know that the demand for critical equipment and supplies will grow in the coming weeks, so we need a sustainable, stable supply of these products. And that means making them at home, and we're optimistic that they will be available in the coming weeks. So today, I'm also announcing that our existing next-generation manufacturing supercluster will be leading companies in developing and scaling up new technologies to test and treat Canadians. Demand for these goods is going up, so we're making sure Canada is ready to keep up. That's why our government is also allocating $2 billion to purchase protective personal equipment, including for bulk purchases with provinces and territories. This includes things like more masks and face shields, gowns, ventilators, test kits and swabs, and hand sanitizer. Protective personal equipment is essential to protect our healthcare workers who are on the front lines of this fight. We recognize that more is needed, and everyone is working day and night to receive essential supplies. We're coordinating with the provinces and territories, the Public Health Agency, and the experts to make sure our healthcare workers get everything they need. This is a priority for our government, and we will continue to source new solutions every day. We're expecting shipments to come in the coming days, and we will continue to work tirelessly to get these supplies to where they're needed. Plusieurs entreprises ont également fait des dons d'équipements et de matériel.
Several companies have donated equipment and medical supplies to deal with COVID-19. Alibaba, for example, has sent 500,000 surgical masks and 10,000 test kits to help us out. COVID-19 Medical Support, which is an organization which brings together healthcare professionals, engineers, entrepreneurs, and representatives of NGOs, is working with several other companies to provide medical equipment. To date, they have obtained a commitment from Bombardier, from 3M, from Metronite to produce PPE. And Toys R Us has also committed to provide baby monitors to Canadian hospitals to provide for better communication between healthcare professionals and patients. These monitors will also help to prevent fruitless moving about by staff in hospitals, which can put people's lives in danger. I'd like to thank all those companies who have stepped up to the plate. You're doing your share, and all Canadians should follow your example.
We will need more masks, ventilators, and testing kits. But how many more we need depends entirely on you. If you stay home and follow public health recommendations, you can slow the spread. And that means fewer patients in our hospitals, fewer people to test, fewer ventilators to use on critical patients. So keep doing your part and help us keep Canada safe. Merci beaucoup.
Merci beaucoup, Monsieur le Premier ministre. Nous allons commencer avec la période de questions par téléphone.
We'll start with the question period. We'll start with the people on the lines today. Moderator, over to you.
The first question, Maura Forrest, Politico. Your line is open.
Thank you, Prime Minister. Yesterday you were asked about pipeline construction continuing on the Trans Mountain expansion, and you said you'd have a better answer today. Now Jason Kenney is saying construction will start on the Keystone XL Pipeline as early as April 1st. Do you have concerns about construction continuing on these projects? Do you think it should stop?
I can assure you that Crown corporations, all Crown corporations, are following all the best medical advice.
Well, I can assure you, in fact, that all Crown corporations are following the advice given by our medical experts.
Politico?
Yes, I mean, that didn't really answer my question. I guess that means you're comfortable with construction continuing. But my follow-up question is about the wage subsidy. You initially promised it at 10%, then last week it was hiked to 75%, but still seemed to be targeted towards small and medium-sized businesses. Now it's available to all businesses. I'm wondering why you've taken such an incremental approach to this measure, given that you're now asking employers to hire back people that they've already laid off.
This situation has been evolving rapidly, as we all know. We're putting in place unprecedented measures to respond to the needs that people are expressing on how we're going to be able to get through this together, how we're going to be able to stay home, self-isolate, not go into work, and yet still be able to pick up our economy when we're through this particular crisis. That is the focus that we've had, and that's why what we're offering is a 75% wage subsidy to companies large and small, nonprofit sector and charitable sector included, so that people can stay on the payroll while they stay home and stay isolated, so that we can ensure that we do bounce back strongly from this once we're through this period.
Merci. Prochaine question.
Next question.
Next question, Mike Blanchfield, the Canadian Press. Your line is open.
Good morning, Prime Minister. You talked about shipments coming in the coming days and the fact that more will be needed, obviously. So I think what I'd like you to do is, can you walk us through your decision-making process around the cabinet table, how you decide how these scarce medical resources will be allocated in the near future? How precisely in detail do you decide what goes where?
Thank you, Mike, for your question. It's a very good one, and I can tell you that we don't decide around the cabinet table. It is not politicians who decide how resources are allocated. We rely on experts, on medical officials, on coordination between medical officials in all different provinces to make the determination on where things are most needed, and we follow the direct advice of medical experts in terms of how to ensure that everyone, everywhere, has the equipment they need.
Follow-up question?
So what input? Yes. So what input then are you looking for from provinces and municipalities as they struggle with this? And does this ramp up of Canadian production, is this a reflection that this has to be a made in Canada solution? We can't rely on exports or imports from the United States, let's say?
We continue to work very, very closely with the provinces to know exactly what the needs are, what the supplies are, where potential gaps might be appearing, depending on trend lines and different modeling. We are in constant communication to ensure that the resources needed in different parts of the country will get there exactly when they're needed. And on the second question, yes, on procurement, the entire world is trying to get its hands on the various equipment needed to fight this virus. That is why we know that it'll be important to be able to have made in Canada solutions. And I am incredibly, incredibly proud of Canadian companies, Canadian suppliers and manufacturers who are stepping up and saying, we want to help, we will help make ventilators, we will help make masks and gowns and all the things that we are going to need in the coming weeks. It has been a truly amazing and inspiring story to see how many factories and manufacturers are stepping up. In the meantime, we're continuing to work very hard on procurement solutions to get the items that we need for the coming weeks. Je suis d'abord extrêmement inspiré.
I'm extremely inspired by what the manufacturers and the Canadian companies have been doing, and we acknowledge that there is a great demand across the world for this very same equipment, and it's going to be important to have solutions, made in Canada solutions as well, that are going to help us to ensure our own needs over the next weeks and months to come. In the meantime, we are working with all the provinces to make sure that we meet their needs and coordinate and ensure that everybody has the equipment necessary where they need it. At the same time, we are working to make sure that deliveries of the same equipment will happen over the next few days. Next question, moderator. The next question, Émilie Bergeron from Agence Clinique. Yes, the floor is yours. Yes, hello, Mr. Trudeau. I would like to know what kind of insurances you've had on the part of companies, the new 5 ones that you've mentioned, that they're going to be able to produce materials in times to respond to the needs. We are trying to accelerate these processes, but we acknowledge that this will take some time and perhaps a few weeks before all of this equipment be able to be delivered from our Canadian manufacturers. This is why we are continuing to receive shipments from materials from all over the world. Another question from Madame Bergeron. Yes, and for Medicom, who was going to be producing masks, N95 masks, how many masks are going to be or are presently ready or will be shortly ready? I do not have that information presently, but I know that there will be a press conference after this one where more details will be provided about the procurement. Last question, moderator. Next question, Marie Vastel from Le Devoir. Yes? Yes, hello, Mr. Trudeau. I'd like to get back to the construction work which is happening for the Trans Mountain Pipeline. You said that you are following the advice of medical experts, but there are Indigenous communities that are very worried about seeing workers coming back and forth in the region. Why not suspend the work in order to protect them from a potential contamination? We understand how the Indigenous communities around the world are vulnerable, and this is why we have taken special measures around the country to ensure that COVID-19 not be propagated in those communities. They are already living a lot of stress from the medical system because of the number of people living per household. We know that there's a lot of things we need to do. Relative to the Trans Mountain Pipeline, I'm confident that the company is making all necessary, taking all necessary steps to ensure safety. In English? Oh, no, I have another question on another subject. On the CERB, are you afraid that this might be is going to dissuade certain people, because it is actually more generous than working minimum wage? Isn't this going to dissuade people from working, and that some people would rather claim the CERB than rather than continuing to work? Well, I understand that we're in a very difficult position right now, and what is important is to make sure that people be able to isolate themselves and distance themselves to keep themselves and their families safe. We also acknowledge that certain jobs are more essential than others. I'm quite confident that working with the provinces, we are going to make sure that what has to be done continues to be done, while ensuring that Canadians have the necessary funds to be able to continue to pay their groceries, pay their rent, and this is something that we will continue to work on together.
People need money to be able to stay home and pay their rents and be able to buy groceries. This is a situation that is unprecedented, and it was really important for us to get money into people's pockets quickly. We recognize that there are going to be challenges around certain essential services, and we're going to work with provinces, and we're going to encourage people to find solutions that will allow people to stay safe while they continue to do the job they need to do.
Prime Minister, I'm wondering, you've talked a lot, and your cabinet ministers have talked a lot about there being enough protective gear for healthcare workers, but we're hearing from healthcare workers that they're being rationed and that they're concerned, that they're afraid to go into work. How do you explain that difference, I guess, between their perspective and the government's?
I think one of the issues that we're facing with is we're looking at a number of different models where worst case scenarios are fairly dire, but the expected track is reasonable and something we think we're going to be able to manage. I think healthcare workers and everyone needs to keep in mind what the potential worst-case scenarios are, and that's why it continues to be so important, not just for us to prepare for every eventuality and be very careful and responsible about how we use the equipment we have, but also impress upon Canadians how important it is that the decisions you make today, whether you go out and how you go out, if you do go out, will have a direct impact on the need that healthcare professionals will be facing a week from now, 10 days from now. That's why it is so important for everyone to keep pressure off our healthcare system by staying home, by making sure that you're making smart choices to keep us all safe.
Pour faire un peu un suivi, M. Trudeau, bonjour.
Another Christian Noël, Radio-Canada. To follow up on Brian's question, we have nurses who are telling us hospitals are asking us to take masks, bring them home, wash them, and reuse them the next day at the hospital. Are we in such a situation of dire shortage that the professionals are endangering their health? Well, we are at a time when we have to be ready for every possible situation, and we need to be responsible and look at how we can make sure that we have the sufficient amount of protective material to ensure the days to come. But I can assure you that we are working day and night to make sure that deliveries happen of all equipments. We are working with companies, Canadian companies, to produce more equipment, and we are reminding Canadians that the choices they are making today, that we are making today, by staying at home or by going out, are going to have a direct impact on the needs that the healthcare system will have within a week or 10 days. And this is why we all have to do our part.
It's extremely important for everyone to do their part in staying home, in making sure that a week from now, 10 days from now, we aren't overwhelmed in our healthcare system. We are looking at a range of models that could lead to different outcomes. We're, of course, preparing for the worst case scenarios, but working towards and certainly hoping for a best case scenario. But that entirely depends on citizens being responsible in their choices. As for decisions made by medical professionals on managing the supplies that they have, I can only salute them for the work that they're working so hard and the decisions they're making to keep us all safe as a country and to keep themselves safe so they can keep keeping us safe.
Au niveau international, il y a
on the international level, there's like a mini war going on for the buying of such medical provisions. Are you worried that Canada is going to find themselves without? There are many things that we should be worried about in this situation. The health of Canadians, first and foremost, and of course the health of our health workers who are working to make sure that we are all safe. We are working with our embassies on an international level to make sure that supplies of other medical equipment be happening, and certainly we're going to be receiving things in the next few days. We are doing our utmost to get deliveries into Canada, but it's also so important to create industry that is going to be able to supply such equipment right here at home and have our own supply chain that is entirely made in Canada. And this is precisely what we are doing. And I want to thank once again all businesses and manufacturers who have been able to adapt their production lines and start making this equipment for Canada and the rest of the world.
We are, of course, working hard to make sure that we receive shipments of needed supplies in the coming days. And I can assure you that our embassy staff around the world is strongly engaged in exactly that. But that's also why it is so important that we have made in Canada supply chains to provide us with this essential equipment for the coming weeks, for the coming months. And that's why I am so pleased to be able to thank the manufacturers and producers across this country who've switched their production over to making this necessary medical equipment because it will ensure that we have solutions in Canada that will cover our needs.
Good morning, Prime Minister. Olivia Stepanovich, CBC News. The Americans are said to be most aggressively scooping up personal protective equipment on the international market. I'm wondering if you found that to be the case, and if so, if you have prevailed upon President Trump to work together to come up with a common North American strategy so you can quickly ship ventilators and other personal protective equipment across the continent to priority areas.
We are working very hard to ensure that Canada receives the equipment that we need, both in the short term and in the medium term, creates production facilities to ensure that we can cover our needs. We understand that countries around the world are taking their own approaches. We will continue to coordinate as much as possible, but every step of the way, our priority will be ensuring that Canada is able to take care of its own.
But are you working with President Trump on a North American strategy? And also, can you tell us exactly how much medical gear has been deployed and delivered so far?
We have been able to cover all our needs up until this point, and expect to be able to cover our needs for medical equipment in the foreseeable future. But that is why it is so important for us to ramp up domestic production as well. And with the United States, we continue to coordinate on a broad range of issues. Nous allons continuer de coordonner avec les Américains sur.
We will continue to coordinate with the Americans on a variety of issues, but of course our goal is to make sure that Canadians have enough equipment to keep themselves safe and healthy.
Delivered so far?
That's a question for the ministers who will be addressing this a little later today.
Brian Mullen, Global News. Prime Minister, with rent due tomorrow, many small and medium-sized Canadian businesses are worried about paying their landlords. What can the federal government do? Is rent forgiveness in some shape or form on the table?
We've already worked with CMHC to ensure that many mortgages are able to be deferred. We've put more money in the pockets of businesses, or putting more money in the pockets of businesses through this wage subsidy, the 75%, that will take off a significant amount of pressure. We've also made available a $40,000 loan for small businesses through the banks that'll be interest-free for the first year, and as they go through it, $10,000 of it under certain conditions will be non-repayable at the end. So there are direct measures for companies to be able to get the liquidity necessary to get through the coming months so that we can be strong once we get through this crisis at the end of it.
Two First Nations communities in Manitoba and other communities are requesting military hospitals be set up. Is this something that the government is contemplating for remote communities with limited access to health care?
We know that our military, the men and women of our military, are always ready to serve, to help in a broad range of ways Canadians who need that support. The field hospitals is certainly an expertise that the Canadian Armed Forces have, and they will make determinations, and we will all make determinations about how we can and where we can best help if it comes to that.
Hi, Prime Minister. Molly Thomas, CTV National News. Canadians, of course, are putting lots of money on their credit cards. They're raking up interest. Last week, you had mentioned that you had talked to banks about possibly deferring that interest. Any more movement on that?
Those conversations continue with the banks. We're also looking at ways of easing access to credit for individuals so that they can shift their bank balances and their credit card balances to a lower interest line of credit. These are things that we're continuing to work on because we recognize that Canadians don't want to come through this with impossible levels of debt, and we're going to be there to help them out.
In French, please.
Okay.
We understand that we do not want to find people indebted at the end of this crisis, and so we will be helping out through the CRB and the Canada Emergency Wage Subsidy. But we also know that we can work with banks, and we are going to encourage them to make changes to the credit card rates, and we're also examining the possibility of access to lines of credit for individuals so that they can get loans or other situations that might cost them less in credit.
China is going to allow Canadian exports of canola. Can you confirm that? And is this a thaw in relations between the two countries?
I think we're recognizing that we're in a global situation where it is really important for countries to work together. We have seen promising signs of positive relations on specific issues, and we're going to continue working to try and ensure that our farmers, our manufacturers, our exporters continue to have access to the markets around the world, even in this difficult time. Okay. Nous allons continuer de travailler avec.
We're going to continue to work with our farmers, our producers, to make sure that they have access to markets for the goods. We recognize, of course, that this is a time when people have to work together. All countries must work together on this effort. I'm very pleased to see promising signs that that's actually happening despite disputes.
And that wraps up Prime Minister Justin Trudeau's address to the nation, a daily occurrence right now from his home at Rideau Cottage. A real emphasis on personal protective equipment, saying that the government is allocating $2 billion to procure this. A lot of questions still remain, of course. Let's bring in Abigail Beeman, who joins us from Ottawa. Abigail, thank you again. So let's talk about this. I mean, 3,000 companies across the country have, offered their help, a number of them doing so. Billions of dollars being allocated for this. Obviously, the need is great and expected to be even greater in the days and the weeks to come. Do you think healthcare workers are satisfied with that response?
Well, we'll have to wait and hear from them. But something that struck me here is, the Prime Minister was asked, how much of this gear coming from other places? I mean, you were talking about the domestic production, which will be ramping up with that Prime Minister's announcement. But in terms of gear and equipment coming from other places, how much has arrived? Where has it been deployed? It's not the first time he was asked that question. We know that equipment from China began arriving on Friday, and we still don't have a clear picture. So in terms of healthcare workers and their response, we hear that the government is taking steps, and we're hearing about what kind of steps they're taking, but we don't know exactly how much of this is going to be produced, is arriving, where it's arriving. We don't really have a full picture of exactly what the need is. And of course, important to note, what the Prime Minister said was, we're going to need more in the coming days, but how much more we need is dependent on how Canadians act today, whether people stay home, whether they follow physical distancing. So we don't have a full picture of how much gear we're going to need, but we also don't really have a full picture of how much has arrived and where we are now. The Prime Minister did say that we have enough medical equipment now and for the immediate future. But again, still not a clear picture of just how long that will last and when exactly these Canadian or domestic companies stepping up, how much can be produced and when.
Yeah, and that could change dramatically, and it depends on where you live in this country. Quebec, the hotspot, obviously serious situation in Ontario, and becoming an increasingly more difficult situation in other provinces. So, given that it is, a provincial matter when it comes to health care, look, you have to accomplish this. And you wonder what's happening in the United States especially. For example, they just approved a program yesterday. The FDA changed the rules on taking the masks and sterilizing them to reuse them up to 80,000 a day. You wonder if that is even a possibility and whether that is in the pipeline when it comes to this country, if that's even needed, if it comes to that point.
Well, I'm sure that that's a question that will be posed. We again have our daily noon Eastern time briefing with ministers as well as health officials, and I'm sure that's a question that will be asked to them because every day we are asking more and more questions specifically around masks. Homemade masks. Should Canadians be wearing them out in the streets? And there is conflicting information, but it's those questions are being asked every day.
All right, we want to also get to the other news because, of course, there are other issues in this country. Actually, do we have Mercedes joining us from Ottawa? All right, we're going to stay with Abigail right now, and I want to ask you of the appointment of Ralph Goodale, the former federal cabinet minister, to be the special advisor to Canada, the federal government, on the Ukraine Airlines plane crash in Iran. What do we make of this, and how significant is that appointment?
It is significant. Ralph Goodale losing his seat in the fall federal election was the biggest surprise for the Liberals. This is a very, very well-respected former parliamentarian, nearly 30 years as an MP, as a cabinet minister. A lot of shock and sadness when he left Ottawa, and a lot of questions immediately about how he was going to stay involved. So this is a person who is very much trusted and respected. It is a significant appointment, as there is, you haven't heard much about that crash, which happened January 8th. Of course, coronavirus has been taking center stage here, but this is certainly a very important file, and now Canada has appointed somebody to lead it.
Yeah, we can't forget that there are other incredibly pressing issues facing this country, and a lot of questions certainly that the families have. Abigail, thank you so much. Let's stay in Ottawa and bring in our Ottawa Bureau Chief, Mercedes Stevenson. And one of the things that he was asked about in many ways and didn't quite get to was the oil and gas, and a lot of people in this country waiting for some answers on the bailout. You see the numbers yesterday where oil closed. We haven't seen those numbers since 2002, hovering around $20 US a barrel. Western Canadian Select, which is a different, heavier type of oil, is basically cheaper than buying a pint of beer in this country. Obviously, people need help quickly. Do we have any sense if there's going to be any change in that narrative from the federal government?
Well, nothing yet, Anthony, and I'd emphasize yet, because that doesn't mean that it's ruled out. I mean, this is such a quickly evolving situation that they sort of do a day of very big announcements. Sorry, I'm just taking this down. Welcome to Technology from Home. Very big announcements, and then the next day, something that's not quite as big. So we had a really big announcement yesterday, today talking about that another big announcement, but there's so much to deal with here, and certainly that doesn't make it any easier on people who are watching, especially out in places like Calgary, Edmonton, Fort McMurray, who've been completely devastated economically through no fault of their own with what has happened with the price of oil, and on top of that, COVID-19. So I know they're looking at a lot of options, and there's supposed to still be more to come for seniors, more to come for vulnerable groups, more to come potentially for oil and gas, but we don't have any sense at this point of what that's going to look like. I know that the province of Alberta is working with the federal government. I know there are conversations between Premier Kenney's office and between the federal government. Their relationship probably is better, at least in public, than it has been in a very long time. That province wants that federal help. We're also expecting to hear from the Alberta Finance Minister, I believe, this morning, and certainly from Premier Kenney later this afternoon. So it'll be interesting to see if they amp the pressure up on the federal government, or perhaps if they have something to share with us. But we'll have to wait and see what happens in those press conferences.
Yeah, and just to give some context too, I mentioned $20 US a barrel. It's up a little bit today. We don't know where it's going to close yet. But Alberta, before this all happened, was budgeting, when they released their budget, for $58 a barrel. So obviously, they were going into this, and obviously in economic, dire straits in many cases. This just, compounds an already difficult situation, doesn't it?
Yeah, absolutely. I mean, if you've planned for $58 a barrel, which is low to begin with, it was starting to rebound, but still very low compared to where it was a few years ago. And now suddenly it's plummeting. Well, that means all that income that the province was planning on, and frankly, in cases the federal government too, because those oil revenues go into lots of federal programs, that reduces your income. So where do you make cuts? Well, it's awfully hard to make cuts when people are already having a really rough time. So we've already heard from Jason Kenney that, what's going to happen will not be at all what they wanted. This is a province that has been financially devastated. They will not be presenting a balanced budget. It is not possible after all of what Premier Kenney had wanted to do there. So they're going to have to take a very different tact. And I think even they don't know yet how much this could potentially cost the province of Alberta, because their primary revenue source has been very deeply damaged by this on top of COVID-19.
Now, I want to recap some of the things that you were talking about earlier in terms of the Canadian Armed Forces mobilization. You look what's happening in the United States. I mean, New York City, for example, obviously a hot spot, more than 1,200 deaths. We saw yesterday a naval hospital ship being sent, now parked off the coast there, to try to mitigate the problem, and they're going to be taking non-COVID-19 related cases to try to help the situation here. Just recap for our viewers what Canada's response could look like if it is called into action.
Sure. So there's three priorities here, basically, that the military is looking at doing. Number one would be what they call preventing the spread of COVID-19. That could be things like enforcing a quarantine. It could be things like we've seen in the UK, where police are asking people for where are you going, why are you out, making sure they're not congregating. That's sort of number one that they could be called in to do. Number two is to help vulnerable communities. That likely means many Indigenous and remote communities who don't have access to healthcare facilities like those of us in cities do. And then the third one would be to help cities themselves manage at the request of a province. So if you're talking about a situation where potentially hospitals are overwhelmed, or they need help with crowd control or registering people or logistics, the military can provide all that. On top of that, there's sort of these individual, what they call tiger teams. They tackle a particular subject. So these would be things like medical experts, or experts in how to evacuate people or how to get food into them. They have biological and hazardous materials experts. All of those people are available to be deployed too. In the short term, what I can tell you they're looking at is up to 24,000 troops. They announced that yesterday. If that happens, it will be the largest military deployment in Canadian history. 2 crews of Canadian naval ships are about to be sequestered. Some people are already sequestered, but that's an entire frigates crew, plus another coastal defense ships crew that are going into sequestration to ensure that they don't have COVID-19. There's been no official asks from provinces yet but there have been 2 First Nations, and the Prime Minister today didn't indicate that he seemed to be considering those requests immediately. Neither of those First Nations communities have any COVID-19 there yet, but they're worried about it. So they're going to wait until I think the military is effectively really needed in areas before they deploy it, but potentially a huge deployment if it does happen.
Yeah, and just to recap, we're still waiting from comments from the finance minister, a little more clarity on what this wage subsidy program will look like. That has changed, as we all know, over the course of the week, from 10% to 75%, from small and medium-sized businesses to now any company with, so basically addressing 75% of their wages. A lot of questions there remain, doesn't it, in terms of really enforcement as well. We don't have a lot of time. In about 30 seconds, real quick, if you could just recap what we expect today.
Yeah, so we're expecting some details on who can apply, how you can apply, and what the enforcement mechanism might look like. Keep in mind here, you have to have lost at least 30% of your revenue to qualify for this program, and it has to go to your employees' wages, Anthony.
All right, Mercedes, we'll have to leave it there. So let's just get a quick recap. Ottawa allocating $2 billion for personal protective equipment. 3 Canadian companies have been contracted to supply medical equipment, obviously a growing need. Of course, we'll cover this extensively throughout the day on globalnews.ca and Global National. I'm Anthony Robard. Thank you so much for watching.
Okay, sorry to be late. Merci pour vous patienter. Bonjour et merci de vous être rejoint à nous aujourd'hui.
Good morning and thank you for being here today.
Let me just start by reminding Canadians that this week is a truly critical week for our country in the fight against the global pandemic. We must practice physical distancing. We must stay strong and stay at home. So unless you are doing essential work like stocking grocery shelves or working on the front lines of our amazing healthcare system, please stay home. You can go for a walk or a run, but maintain your distance and wash your hands when you get home. I know that this is very hard, but I also know that Canadians are resilient, and I know that we can do this. Il s'agit d'une semaine critique dans notre lutte contre le virus. Les Canadiens et Canadiennes doivent pratiquer la distanciation physique. Restez forts et restez à la maison. À moins que vous fassiez un travail essentiel comme remplir les étagères à l'épicerie ou fournir des soins de santé. Vous pouvez aller prendre une marche ou aller courir. Mais restez loin des autres et lavez-vous les mains lorsque vous rentrez chez vous. Je sais que c'est très difficile, mais les Canadiens et Canadiennes sont résilients et je sais que nous pouvons le faire. So today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Minister of Public Services and Procurement, Anita Anand, the Minister of Innovation, Science and Innovation, Navdeep Bains, et le président du Conseil du Trésor et le vice-président du comité du cabinet sur le COVID-19, Jean-Yves Duclos. Dr. Tam, please.
Bonjour à toutes et à tous.
Good morning, everyone.
So I'm going to begin by an update on our number of cases. But I'm going to use the number that's published on our website as of 9 a.m. this morning, just because, as you know, this is a dynamic situation as different provinces are announcing different things as we speak. So in Canada, as of 9 a.m. this morning, there were 7,708 cases of COVID-19, including 89 deaths. So in addition, at any point in time, there are many other people under investigation, awaiting lab results, or not yet tested. So even if you're not hearing cases in your community, it doesn't mean that there are no cases and that there are no exposures waiting to happen. So we now have completed tests for over 236,000 people in Canada, with about 3.5% of people confirmed as positive and over 93% confirmed as negative. Pour le moment, la principale préoccupation concerne l'introduction et la propagation de virus dans des milieux fermés où habitent des personnes vulnérables. Il y a actuellement un certain nombre d'éclosions dans les établissements de soins de longue durée, des collectivités de Premières Nations et Inuits et dans les établissements correctionnels. Il s'agit de situations fort préoccupantes parce que ces éclosions accélèrent la propagation du virus, mais surtout en raison des graves conséquences pour ces personnes à risque élevé. De plus, les jeunes ne sont pas à l'abri des complications graves. Les adultes de moins de 40 ans représentent 10% de cas qui ont nécessité une hospitalisation et pas plus tard qu'hier. Le décès d'une personne dans la trentaine des suites de la COVID-19 a été signalé. Our greatest concern at the moment relate to the introduction and spread of the virus in enclosed settings where vulnerable people reside. We currently have a number of ongoing outbreaks in long-term care homes, cases in First Nations and Inuit communities, and a corrections facility. These events are deeply troubling both because they result in outbreaks that accelerate the spread of the virus, but more so because of the serious consequences for those high-risk individuals. However, the young are not spared from severe outcomes. Adults under 40 account for 10% of hospitalizations, and just yesterday, there was the first report of an individual in their 30s who died of COVID-19. We must prevent introduction into vulnerable population at all costs, as well as prevent new travel-related cases from sparking community spread. As all Canadians continue to strictly adhere to physical distancing to protect themselves and others, we expect all travellers coming into Canada to join these efforts. Moreover, because of an increased risk of COVID-19 outside of Canada, the quarantine order now in place requires these travellers go directly home upon arrival and quarantine themselves for 14 days. So we all need to keep up physical distancing while maintaining social connections. Thank you.
Okay, thank you very much, Dr. Tam. Now we will hear from our Minister of Public Services and Procurement, Anita Anand. Anita, please.
Merci beaucoup, Christia, et bonjour tout le monde. Alors que nous continuons à travailler dans cette situation vraiment extraordinaire, je tiens à remercier les travailleurs essentiels du Canada. Votre travail aide à contenir la propagation de la COVID-19 et nous vous en sommes extrêmement reconnaissants. As part of these efforts, Public Services and Procurement Canada is aggressively buying in bulk from all available suppliers and distributors. To date, we have ordered millions of swabs, gloves, masks, and other vital equipment. I'll take a moment now to highlight additional progress that we are making. Nous avons signé un contrat avec Medicom de Pointe-Claire, Québec, pour fournir une importante réserve de masques chirurgicaux. Including this order, we have now managed to secure more than 157 million surgical masks to support the response. To date, we have also ordered more than 60 million N95 masks, a key piece of protection for healthcare workers. Delivery of these will begin this week. Nous travaillons également avec Spartan d'Ottawa, qui fournira des trousses de tests rapides pour la COVID-19. Spartan's Made in Canada kits will enable us to test many more Canadians over and above the millions of tests that we have already ordered. On ventilators, we have a significant order through Thornhill Medical in Toronto, part of the 1,570 ventilators that we have ordered from companies in Canada, Europe, the United States, and overseas. We are working to secure upwards of 4,000 additional ventilators and very possibly more. Canadians have always risen to the occasion in times of challenge, and the companies with whom we are working, from every region in Canada and abroad, are clear examples of this important point. I also want to thank Suncor and Home Depot for stepping up with generous donations of personal protective equipment. Nous savons à quel point ces fournitures sont importantes pour lutter contre la COVID-19. SPAC appuiera l'investissement supplémentaire de 2 milliards de dollars dans l'Agence de la santé publique du Canada pour l'achat d'équipements de protection individuelle, y compris pour les achats en vrac avec les provinces et les territoires. We know how important these supplies are to the fight against COVID-19. PSPC will support the additional $2 billion investment in the Public Health Agency of Canada to purchase personal protective equipment, including for bulk purchases with provinces and territories. These funds will continue to be dedicated to purchasing the equipment necessary for our doctors and nurses, hospitals, and other frontline health workers across this country. Notre objectif est d'être aussi bien préparés que possible, et les Canadiens peuvent avoir l'assurance que nous explorons toutes options possibles. I also want Canadians to know that we are working together in these unprecedented times. I have reached out to my provincial and territorial counterparts to ensure that we have strong and established lines of communication with regard to procurement, in addition to the work that is already being done by ministers of health across this country. J'ai communiqué avec mes homologues provinciaux et territoriaux pour m'assurer que nous avons des voies de communication solides et bien établies en ce qui concerne l'approvisionnement, en plus du travail effectué par les ministres de la Santé. Extraordinary measures are required in these extraordinary times to limit the spread of COVID-19, protect critical infrastructure, and ensure that Canada has the supplies required. Our government is leaving no stone unturned. It is all hands on deck right now. Merci beaucoup. Thank you.
Okay, thank you very much, Anita. And now we'll hear from the Minister of Innovation, Science and Industry, Navdeep Bains. Nav, please.
Thank you very much, Christia. A little over a week ago, our government announced Canada's plan to mobilize industry to fight COVID-19. Ce plan a comme but de fournir de l'équipement médical essentiel au personnel de la santé et priorise la santé et la sécurité des Canadiens. Since then, we've achieved considerable progress. And as Minister Anand just announced, we've advanced to the procurement stage with the 3 companies we highlighted last week. On Medicom, I will say that in addition to the immediate mask procurement, we are in the process of finalizing an agreement to support the development of manufacturing capacity in Canada. It's strengthening our domestic supply. That remains a core objective of ours, to make sure we have the ability to build these masks within Canada. Another part of our last announcement included a call to action, asking companies to step up in this fight against COVID-19. Well, as of noon yesterday, we have received over 3,200 emails from companies, and we've directly connected with over 2,900 of them. Whether it's companies with ready-to-go products, with products not yet authorized, or for companies whose products need a little more development or who need help scaling up. If you tell us you want help, we will connect you with the relevant federal support to ensure we increase domestic supply so that we have Canadian solutions ready to protect and support Canadians. We have now signed additional letters of intent with 5 companies who have signaled they can assist in the government's response to COVID-19. supplying testing kits, hand sanitizers, personal protective equipment, and medical apparel. As I said, we're refocusing our industrial policy and are deploying funds on an accelerated basis through shortened applications and faster approvals. We're committed to pursuing this strategy to do all we can to make sure that we help our healthcare workers. C'est encourageant de voir que les entreprises sont prêtes à faire face aux défis. Elles travaillent ensemble pour fournir aux travailleurs de la santé l'équipement et la protection dont ils ont besoin. We're also helping bring together industry partners, from the Cosmetics Alliance Canada to Canadian Consumer Specialty Products Association and Spirits Canada. Together, they're working to facilitate the supply of key ingredients to maximize the domestic production of hand sanitizers and disinfectants. Another important step that we've taken is advancing the Next Generation Manufacturing Supercluster Initiative, which brings together more than 970 members into a Canada-wide manufacturing network. It recently put out a call for proposals to its members, and it's making $50 million available to develop and scale up new health products and equipment that are in short supply. And within 48 hours of issuing this call, the Supercluster reviewed and conditionally approved 3 projects for innovative manufacturers to produce ventilators, testing kits, and face shields. As my colleague mentioned, I also want to take this opportunity to recognize companies like General Motors, Ford, Toyota, Linamar, Magna, Shell, Suncor, Home Depot, and Canada Goose. All of them have contributed to the response by donating personal protective equipment and health supplies to local hospitals and medical facilities. And I encourage other companies to follow their lead in generously donating whatever they can during this challenging time. And let me wrap up by reminding everyone that we're in this together, and I'm proud of how industry has stepped up to fight COVID-19. Nous avons tous un rôle à jouer pour aplatir la courbe et soutenir l'économie du Canada. Merci. Thank you.
Okay, thank you, Nav. Et maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. Jean-Yves.
Merci, Christia. Aujourd'hui, nous faisons le point sur la mobilisation de 2 forces importantes du pays et des Canadiens. La première, c'est la capacité considérable d'approvisionnement du gouvernement canadien. Et la deuxième, c'est la puissance industrielle significative du pays. Nous annonçons et nous faisons le point aujourd'hui sur cet investissement de 2 milliards de dollars dans les opérations d'approvisionnement du gouvernement canadien pour l'achat d'équipements de tests et de développement de procédures de dépistage rapide, dans l'achat d'équipements de protection individuelle et de désinfectants, dans l'achat de médicaments et de produits pour traiter les gens qui sont malades et dans la fourniture d'équipements médicaux, dont les respirateurs. Nous faisons aussi le point sur l'importante mobilisation de la capacité productive du gouvernement et des entreprises privées à travers le pays. Des milliers d'entreprises se mobilisent pour appuyer les efforts du gouvernement canadien pour appuyer les opérations de santé publique et de soins de santé. Et le Conseil du Trésor travaille étroitement avec Approvisionnement et Services publics Canada pour faciliter et accélérer le travail de collaboration de ces entreprises avec le gouvernement canadien.
OK. Merci, Jean-Yves. Et maintenant, on est prêt à répondre à vos questions.
Merci. Alors, comme d'habitude, on va commencer par 3 questions au téléphone. 3 questions on the phone, 1 question, 1 follow-up, and then we'll turn to the room. Operator.
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, faites étoile 1 sur votre téléphone à clavier. We have a question from Mission Laflamme, Radio-Canada. Please go ahead. Votre ligne est ouverte.
Oui, merci. J'aimerais savoir, est-ce que votre objectif, c'est de devenir autosuffisant pour la production d'équipements personnels ou est-ce que ou peut-être de certains équipements qui sont difficiles à obtenir sur le marché international, et quel est votre échéancier?
Je pense que c'est une question pour Anita et pour Nav. Qui veut commencer?
I think that Anita and Nav will be able to
Press
answer
your
those
mic,
questions.
Pardon. Merci beaucoup pour la
Thank you very
question.
much
Nous
for your
travaillons
question.
en collaboration
We're
avec
working
l'ensemble
and
du gouvernement
collaborating with
et en partenariat avec les
entire
provinces, les territoires
government
et
and in
l'industrie
partnership with
pour nous
provinces and territories
procurer les
and
biens
industry
et
in
les
order
services
to
dont nous
obtain
avons
the goods
besoin
and
en cette
services that
période
we need
extraordinaire.
in this
Il y a beaucoup de
extraordinary
choses
period.
que
There
nous
are
faisons
many things
maintenant.
that we're
Nous
doing at this
travaillons
stage.
par tous les
We're
moyens
working
possibles pour
through all
obtenir
methods possible
les
to
fournitures
obtain
médicales essentielles
all
dans le
the
Canada
national,
et
the
dans le
essential
monde
medical
pour
equipment
soutenir
for
les
Canada,
provinces
and
et
we're
les
looking
territoires,
overseas
nos
as well
travailleurs
to
de la
support
santé de
our
première ligne et les
provinces and
Canadiens
territories
en
and
général. Et
Canadians
donc,
and healthcare
peut-être mon
workers as
collègue
well. And so perhaps my
ajouter quelque
colleague
chose.
would
Non,
like to add
merci beaucoup, Anita. Notre stratégie est claire, elle a raison. Nous allons continuer à travailler avec d'autres juridictions pour obtenir l'équipement essentiel. Et en même temps, nous allons avoir une stratégie pour la fabrication ici au Canada. C'est pourquoi aujourd'hui, nous avons annoncé 3 entreprises qui peuvent fabriquer l'équipement essentiel ici au Canada. So, notre stratégie debout ici au Canada pour les capacités domestiques et en même temps, nous allons continuer à acheter l'équipement essentiel par tout le monde. Micheline, en suivi.
Merci. Oui, merci. Et en ce qui concerne Medicom, vous indiquez qu'il pourrait y avoir une entente très bientôt pour la construction d'une nouvelle usine. Pouvez-vous nous en dire un peu plus à ce sujet-là?
Oui, nous allons investir beaucoup d'argent. Je ne peux pas confirmer combien d'argent maintenant, à bientôt, j'espère, que nous allons investir pour une usine qui va fabriquer l'équipement essentiel ici à Montréal, seulement pour les Canadiens pour le moment. Et j'espère d'envoyer pour les autres juridictions, mais pour le moment, c'est une priorité pour les Canadiens ici. So we are going to invest in Medicom through the Strategic Innovation Fund to produce masks here for Canadians. So we have domestic capacity. And the goal is not only to meet domestic capacity requirements, but ultimately to produce masks for other jurisdictions in the future as well.
Thank you, Minister. Operator, next question, please.
Thank you. The next question is from Briar Stewart, CBC News. Please go ahead. Your line is now open.
Yes, thank you. This question is for Dr. Tam. I'm wondering if there's any national tracking going on regarding the number of healthcare workers that have become infected with COVID-19.
Yeah, that's a very important question, and it is part of the data that we wish to get confirmed by the province and territory, so we're working very hard to do that. But of course, we do know of a number of healthcare workers, and particularly related to the long-term care facility outbreaks that you've heard about. Some of the health workers were the initial cases, followed by the residents. And so those are the kind of settings, actually, where that is going on. So we do have knowledge about those particular outbreaks.
And I'm just wondering, as a follow-up, I mean, we've heard from other countries where, you know, they're further down the road in this, that there are some times when doctors, as many as 1 in 4, are off sick at one time because of COVID-19. I'm wondering what kind of contingency plans are in place in Canada if that were to happen here.
I think protecting the healthcare workers in the first place is very important, and it will go all the way from health workers who had traveled. We need to pay special attention to them, making sure that they're not sick and that they're not spreading, of course, the virus in both their family context or in the hospital context. That's really key. So having processes that screen and stop infection from spreading in those healthcare institutions protects the health workers as well as the patients or the residences. Of course, the personal protective equipment that you've just talked about. But of course, as a health professional, I think we all have to also practice everything that we preach, including social distancing, protecting our patients and our family. But for sure, protecting the health workforce is absolutely critical. Secondly, is looking at surge capacity. So with the provinces and territories having already engaged medical colleges, retired healthcare professionals, students who are studying in the medical professional field, and all of those engagements are now taking place with provinces already engaging that kind of surge capacity as they need to do, for example, contact tracing for the public health side, as well as surge for the healthcare system itself. So that planning is extremely active right now so that we maintain that health workforce.
Thank you, Dr. Operator. Third question on the phone before we go back to the room.
Thank you. The next question is from Manon Cornelier from Le Devoir. Please go ahead. Votre ligne est ouverte.
Oui, bonjour. J'aimerais... Monsieur Legault, le premier ministre du Québec hier a dit qu'il allait essayer de regarder ce qu'il pouvait faire pour ces personnes qui travaillent dans les services essentiels. Vous avez mentionné Mme Freeland qui remplissent les tablettes des épiceries pour les compenser financièrement parce que ces gens-là sont souvent payés au salaire minimum, donc moins par semaine que ce que va offrir votre prestation d'urgence. Est-ce que le gouvernement fédéral envisage des correctifs aussi de ce côté-là pour éviter de voir les gens qui offrent des services essentiels mais qui sont sous-payés ne pas être dans une situation inéquitable?
Merci pour la question. La priorité pour notre gouvernement au niveau économique était premièrement d'être certain que tous les travailleurs peuvent rester à la maison si c'est nécessaire ou pour isolation de soi-même ou pour aider les gens, les enfants qui ne sont pas à l'école, les membres de famille qui sont malades et aussi pour aider les travailleurs qui ont perdu son emploi à cause des effets économiques de COVID-19. C'était la première chose importante. Deuxièmement, et c'est ce que le Premier ministre a annoncé vendredi, c'était pour aider les employeurs, les travailleurs à rester au travail, aider les entreprises, aider les liens entre les travailleurs et les entreprises. On a fait ça aussi. Nous comprenons qu'il y a des industries, des secteurs, incluant les secteurs essentiels, où il y a premièrement une situation où notre pays a un besoin extrême du travail de ces gens dans les services essentiels, mais aussi où il y a des conséquences économiques à cause de nos politiques nécessaires. Et je peux dire que le fédéral est d'accord avec le Premier ministre Legault qu'on doit penser de ces conséquences et on doit trouver une façon équitable pour tous les travailleurs du Canada, absolument incluant ces gens qui font des travaux essentiels comme le travail aux épiceries.
Est-ce que vous avez un échéancier ou un objectif d'offrir cette solution équitable dans les prochains jours où les gens doivent se ronger les sangs à ce sujet-là?
Comme on a expliqué, c'est une situation extraordinaire et notre gouvernement a compris que c'est important d'agir très, très vite. C'est ce que la situation demande. Mais une des conséquences des réactions de la politique plus vite que dans une situation normale est qu'il y a des situations dans lesquelles on annonce une politique, on commence à faire quelque chose, mais on doit dans les jours après, mettre en place tous les détails. C'est ce qu'on est en train de faire. Je ne peux pas aujourd'hui annoncer les détails concernant la situation duquel vous avez posé une question, mais je peux dire qu'on est d'accord avec le Premier ministre Legault, qui fait un très bon travail, que c'est une situation duquel on doit penser et on doit faire quelque chose.
Thank you, Deputy Prime Minister. We'll start with the room. Dylan?
Has decided to send asylum claimants back to the United States on the basis of public health. Given that you can speak independent of the government, I'm wondering if you think this will help public health, if this is putting people at more risk, if we see people sneaking around to come in without reporting, and specifically, what did you advise the government about these crossings?
Well, I think obviously in terms of both protecting whoever's crossing and the rest of the population is extremely important for managing this particular epidemic. So I think from our public health perspective, we're there to do the screening and making sure that together with CBSA, anyone who is sick is properly managed. Of course, a reduction in the number of travelers from any entry point can potentially reduce the introduction, of course, to Canada. And so it's just different layers of measure, I think. But I think that's partly it. And of course, we need to look after each other on both sides of the border as much as we are working on our side. I think our public health officials on the other side of the border is also managing anyone who's sick as well.
And Minister Freeland, your government has talked about a nation-to-nation relationship with Indigenous people. We're seeing some First Nations ask for military support. I'm wondering if they're under the thumb of the provinces, if there's a disagreement with the province, are you going to work with a First Nation? We're expecting a flood risk in Manitoba this year. I'm just wondering if you would be prioritizing that over a request for a field hospital in a First Nations community.
Thank you very much for the question, and thank you for your real focus on Indigenous issues. We really appreciate it. Mark Miller and I were talking about your work, actually. So look, to the flood point, we are very aware that there are emergency situations in Canada every year, even in the years when we are not facing a global pandemic. And Minister Blair and Minister Miller have been working very hard with their teams, specifically, and I should also say Minister Sajjan, and we have been having discussions to prepare to walk and chew gum at the same time. And it's important for Canadians to appreciate that. Floods happen every year. We have been seeing more extreme weather events. And so we appreciate that we need to be ready to handle those potential extreme weather events, even as we continue to work hard to fight the global pandemic. That is the particular responsibility of the Minister of Public Safety, and he is definitely on it. The Minister of Defense and DND is very, very focused on the military's particular role this season and this year to defend and support Canadians, and that's why we heard from them yesterday. When it comes to Indigenous communities in particular, Minister Miller is very, very focused on the specific needs. We heard from Dr. Tam just now that we really appreciate the specific vulnerabilities of Indigenous and Northern communities, and Minister Miller is working closely with Indigenous and Northern communities to understand specifically what they need and specifically what we will need to do to support them. Nothing is off the table.
Merci, Madame la Vice-Première Ministre. Next question, CTV.
I think this is for Minister Anand and Bains. Just going back to the companies that you're working with to produce medical equipment and from other equipment that we're procuring, say, internationally, when exactly are we going to see these companies produce equipment and get that in the hospital, specifically, like a timeline on that? And are we going to allow these companies to produce equipment that we then sell internationally or donate to other countries around the world?
I'll begin and then I'll hand it over to Nav. Thank you for the question. I want to begin by talking about what we do at Public Services and Procurement every single day, 24/7. We are purchasing a broad range of personal protective equipment. We've received already masks, surgical and N95 gloves, and hand sanitizer, and expecting ventilator swabs, gloves, and additional masks in the future. So we are taking a very aggressive and proactive approach to procurement every day. We are working 24/7, and this country has never seen procurement like it is occurring right now. It is broad-based and it's aggressive. And on that basis, I will say that the timeline is long. We are engaged in procurement immediately as well as in the long term to ensure that Canadians have the equipment that they need to keep frontline healthcare workers and beyond safe. And in terms of the particular companies, we are expecting supplies this week, actually, ventilators in particular. And I will turn it over to Nav, who can continue with the explanation.
No, thank you very much, Anita. Just to build on what Anita has said, we are dealing with global demand. And of course, we recognize that our global supply chains are also, there's enormous amount of pressure and they're unstable as well. That's why we are partnering up with industry to build domestic capacity. The Medicom example that I highlighted with you earlier is an example of how we're using industrial programming like the Strategic Innovation Fund to build up that capacity with the primary objective of providing essential medical equipment for Canadians. So these are Canadian companies that are retooling to provide solutions to Canadians, particularly for frontline healthcare workers and to support our healthcare system. And so that is our number one objective. In the long term, if we're in a position to build up such significant domestic capacity to help out other jurisdictions, I think it's incumbent upon us to consider that because this is a global pandemic. This is not about just protecting Canadian lives, but we have a responsibility to other countries. But right now, our primary objective is to recognize that global demand is going up, global supply chains are unstable. We need to build domestic capacity to protect Canadians, and that's exactly what we're doing.
And so they are mandated then to keep what they're producing here in Canada for Canadians.
So when we are, for example, in an arrangement with them to help them retool or rescale, clearly the objective is to make sure we meet with the demands and the requests made by the provinces and territories. That is the objective, saying we are going to help you scale up or retool so that you can provide those essential medical pieces of equipment, personal protective equipment for Canadian frontline healthcare workers. That is clearly the objective. But as I was saying, in the long term, because as Minister Anand just mentioned, some of this equipment is going to be made available not in months, but in weeks. We want to make sure that we provide that equipment for Canadian healthcare workers. And then down the road, if we're in a fortunate position where we have the ability to help other jurisdictions out, we should also consider that. But the number one priority is helping Canadian healthcare workers.
Okay.
Sorry, that was one question, one follow-up already. That was a follow-up. There's a lot of folks on the line. Sir, Julie, CBC.
My second question, though, was about...
It's one question, one follow-up, please. Okay.
Thank you. My second question was about... There have been numerous reports in Europe about masks coming from China being defective. The Chinese embassy here in Ottawa tweeted the Bank of China has donated us some masks. Are we doing any checks to make sure what we're getting from China is effective and functional?
Well, I thank you for the question. And obviously that question pertains to goods across the board, not only from China, that public health has specifications and requirements that need to be met in order for PPE to be distributed and utilized safely by frontline healthcare workers. And so I will say that once the shipment comes in, and I'll ask Dr. Tam if she'd like to add in on this point, there is inspection to make sure that the specifications are met. In addition, we are making sure that in China there is quality control on the ground there. I have been in close touch with Ambassador Dominic Barton actually every single day to make sure that we have people on the ground in China who are assisting us with our procurements there. And they are performing an excellent and very useful service for Canadians on the ground in China, and that makes the procurement process in many, many respects much more smooth. Dr. Tam?
Yes, I can confirm that any kind of donation, we will need to make sure that we meet the standards in Canada. So Health Canada, who's the regulatory authority, has posted those criteria and guidance, but each of those donations will be checked in terms of whether they meet the standards.
Julie, CBC.
Yeah, hi, Julie Van Dusen, CBC. I'm not sure if it's for Ms. Freeland or for Dr. Tam, but we know that about a third of the 65 COVID-positive cases in Windsor, Essex, are Canadian healthcare workers who cross the border. They work in Detroit. They come back with the virus. So the question is it time to stop the back and forth, or is there another way to deal with it?
I'll start that answer because actually last night I had a very good conversation with the mayor of Windsor about precisely this issue. He is very focused on it, as are the local MPs, and he has been in very close touch with he reported to me that he's been in close touch with both the Canadian hospitals and the U.S. hospitals. It's a measure of how closely intertwined our economies are, that there are in Windsor both Canadian healthcare workers who every day cross the border to work in Detroit, and there are also people who cross the border from the United States every day to work in the Canadian healthcare system. Stepped up measures have been put in place at the hospitals, both on the U.S. and Canadian side of the border, to very carefully check the health of the healthcare workers to be sure when they go to work and when they leave work that they are healthy and well. And also opportunities have been offered to them if they would prefer not to go home to their families to be able to stay in hotels close to where they are working. So a lot of very hard, very important work is being done on the ground in Windsor. And I really want to say the mayor is completely on it. And I want to thank him for his hard work. It is a situation that we are monitoring closely, and we need to monitor closely, and we are going to continue to do that every single day. And if Dr. Tam wants to add something.
I think just to add that we're also connecting with Ontario and their public health officials in terms of the sort of procedures and guidelines that they're putting in place as well for healthcare workers, but not much more to add. Thank you.
My second question is to either Ms. Freeland or Dr. Tam. And again, it's the fact that for the past few days, everyone's been saying this is a crucial week to see if physical distancing, staying at home, self-isolating is working. I guess the question is, what happens if it's not and infections continue to rise? Is there a plan B?
Look, I'll start. Just to say, we all need to be prepared for the reality, which is the situation is going to get worse before it gets better. That is the unfortunate truth of where we are right now. I'm delighted by the way you framed your question, Julie, because it shows that people are understanding that we can actually make a difference. You know, we mustn't be fatalistic about this. And if we take the right actions, we can have the least bad outcome for Canada. And taking the right actions means, first and foremost, Canadians every day practicing physical distancing. This is a particular kind of crisis where every single person in the country can make a difference. And I know that people are trying really hard, and I can't emphasize too strongly the need to do that. So I think the first answer to the question is, let's do everything we can, and each one of us has real power here to avert the worst case scenario. Having said that, of course, it is incumbent on all of us in government to do everything we can to prepare for a less good outcome. That's why you've heard today from Anita and Nav on the truly extraordinary efforts we're making in procurement internationally and getting Canadian companies who have been terrific, working hard to build what we need at home. I also really want to commend the work of premiers across the country and to give you a sense of how focused the premiers are on being ready for worst case outcomes. I can tell you that just this morning, I was on a conference call with Doug Ford and Francois Legault, which Premier Ford organized himself on his phone to work on procurement. And I had a text from Premier Horgan also with very specific questions. So this is a real Team Canada effort. The premiers are doing extraordinary work. We are getting ready for a less good outcome. But at the same time, even as we say that, let's all of us remember that what we need to do today is do the best we can to avert that. And I think we would all love to hear from Dr. Tam as well about this.
More to restrict those movements in some way. So mass gatherings, when we started, absolutely we shouldn't be going to conferences or these mass gatherings, and then it went down to 250 and then 50, and now pretty much everyone's saying, look, we need to really buckle down and do our maximum so the physical distancing, making sure vulnerable populations stay home and support them so that they're not at risk of infection potentially in the community or other settings. And all the sort of essential services, having them make sure grocery stores or other places where people do have to visit are also practicing social distancing measures. So that is so important. That's where I think, as we speak, we're still enhancing those measures, and we'll want to see the effect of those, absolutely. And then, of course, at the same time, preparing for the scenarios where you can get increased influx of patients, alternative sites for evaluating patients. How do you house people who are mildly sick but can't be self-isolating at home, having hotels and other things. Homeless shelters cannot manage these outbreaks, so you need alternative sites to manage and isolate people from those vulnerable settings. All of this is happening right now. And so I think that's why I say this week, again, double down and keep going. Is the whole of society response.
Thank you. Operator, Operator, we'll take 3 more questions on the phone, please.
Thank you. The next question is from Raymond Filion, TVA. Please go ahead. Votre ligne est ouverte.
Oui, bonjour à tous. Des médecins, des infirmières qui sont sur les lignes de front, des hôpitaux aussi au Québec craignent une pénurie de masques. Je vois que présentement le premier ministre Legault parle de pénurie possible dans 3 à 7 jours. Est-ce que effectivement il y a danger de pénurie d'équipement à l'heure actuelle?
In the next 3 to 7 days, is there a danger in that regard?
Merci beaucoup. Oui, c'est très important d'avoir des masques et d'autres équipements pour les médecins et les autres gens qui travaillent sur la première ligne. Et je vous assurer que nous avons procuré des masques, différents types de masques pour les emplois, pour les travailleurs aussi. As I mentioned, we have ordered 60.9 million N95 masks and 157.5 million surgical masks, and some of those are being produced right here in Canada. Donc oui, c'est très important et nous travaillons fort de procurer l'équipement pour les Canadiens et les Canadiennes.
Mais ma question, c'est est-ce qu'il y a un risque, un danger de pénurie? Vous avez répondu qu'il est important d'avoir des masques. Je comprends, tout le monde en convient, mais est-ce qu'il y a danger, un risque de pénurie? Is there a risk of a shortage?
Maintenant, nous travaillons chaque jour et chaque nuit de procurer, d'acheter des masques so that there will not be the risk. And we are working very hard to make sure that we have that equipment to distribute not only to Quebec, but to every single province in this country. And I will add that our efforts are supplementary to the efforts that individual provinces themselves are making. And so, c'est Équipe Canada, as Christia said, we are working as a country with the provinces every single day to make sure that we have the equipment that frontline healthcare workers and others require to keep our country safe and to fight against COVID-19.
Si je peux le dire rapidement. Si je peux, bonjour, M. Fillon. Si je peux vous rassurer, ce qu'on vous entendez ce matin, c'est que la capacité d'approvisionnement du gouvernement canadien et la capacité industrielle du Canada sont entièrement mobilisées pour nous surprotéger. On surproduit pour faire en sorte qu'on ait le maximum d'équipements de protection personnelle et d'autres équipements absolument essentiels dont les travailleurs dans les milieux de soins de santé ont absolument besoin. Nous sommes évidemment en appui aux travaux et aux opérations essentielles que font tous les gouvernements des provinces, incluant celui du gouvernement du Québec, parce que nous savons qu'il y a non seulement présentement une disponibilité suffisante, mais il y a aussi évidemment ce souci d'être surprotégé, de surproduire pour que toute la capacité industrielle du pays soit tournée vers la fourniture de quantité suffisante du matériel de protection.
Merci, M. le ministre. Opératrice, prochaine question, s'il vous plaît.
Thank you. The next question is from Philippe Vincent Foisy, Radio-Canada. Please go ahead. Votre ligne est ouverte.
Oui, M. Duclos, juste vous entendre là-dessus. Je ne suis pas sûr si j'ai bien compris, mais est-ce qu'aujourd'hui, vous êtes capable de dire que dans 2 semaines, si on continue à avoir une hausse de cas comme on connaît actuellement, très, très importante, dans 2 semaines, toutes les infirmières, tous les médecins, tous les patients qui ont besoin d'un respirateur vont avoir le matériel requis. Est-ce que c'est ce que vous nous dites? Dans 2 semaines, dans 3 semaines, tout le monde va avoir du matériel. On ne sera pas obligé de le laver, on ne sera pas obligé de prendre des décisions crève-cœur sur les respirateurs.
Ce qu'on dit aujourd'hui, c'est qu'il faut produire au maximum la capacité industrielle du Canada. Nous faisons face à beaucoup d'incertitudes par rapport à ce qui va se passer dans les prochaines semaines. Un message important, évidemment, c'est que nous avons tous une responsabilité pour faire en sorte que ces scénarios soient les meilleurs possibles dans les prochains jours et les prochaines semaines. Mais le gouvernement canadien a aussi la responsabilité de mobiliser toute la puissance industrielle du pays pour faire en sorte que nous ayons le maximum de ressources disponibles au cours des prochaines semaines et que nous soyons donc prêts au maximum possible à tous les scénarios qui puissent se produire.
Mais est-ce que vous êtes prêts? Est-ce que les gens... Est-ce qu'on peut dire...
S'il te plaît.
J'ai juste posé une question. J'ai juste posé une question. Hey, j'ai juste posé une question.
Pardon, PV, c'est moi qui ai mal compté, vas-y.
Sorry, I miscounted. Yes.
Est-ce qu'on peut dire aux Canadiens, le gouvernement promet qu'il y aura du matériel pour toutes les situations, même la pire qui est prévue.
On vous aime beaucoup, Philippe Vincent, et des fois, il y a des communications un peu brisées, comme vous êtes un peu à distance, là. Mais c'est correct comme ça dans la situation actuelle. Mais ce qu'on peut dire aux Canadiens et évidemment aux Québécois, c'est que le gouvernement canadien est en mode de mobilisation, pratiquement de guerre. Nous mettons toute la puissance industrielle du gouvernement et du Canada au service de la production des équipements dont les provinces et les territoires vont avoir besoin au cours des prochaines semaines. On travaille évidemment très fort avec les provinces et les territoires pour s'assurer que ces équipements soient non seulement disponibles, mais disponibles au bon moment. Nous avons confiance dans cette capacité de collaboration avec les provinces et les territoires. On se prépare pour les pires scénarios, mais on travaille évidemment pour que ces scénarios qui vont effectivement se réaliser soient les meilleurs possibles.
Prochaine question.
Thank you. The next question is from Mélanie Marquis de la Presse. Your line is open. Votre ligne est ouverte.
Merci. Bonjour, ma première question pour la ministre Freeland. J'aimerais savoir si vous avez une mise à jour concernant le renvoi de migrants dans leur pays d'origine, donc les États-Unis, qui renvoyaient les migrants que le Canada refoulait à la frontière en vertu de la nouvelle entente. Est-ce que vous avez réussi à obtenir quelque chose?
Je peux dire que c'est un enjeu très important pour nous. Le travail continue. J'étais en contact avec le ministre Blair hier soir et ce matin concernant cet enjeu. Il est très engagé et aussi notre ambassadeur aux États-Unis, Kirsten Hillman, est actuellement engagé et avec nos homologues américains. Et je peux assurer les Canadiens que le Canada prend au sérieux nos obligations internationales concernant les demandeurs d'asile et que le Canada ne fera pas jamais quelque chose qui va contre ses obligations.
Monsieur Duclos, maintenant, sur un plan un petit peu plus économique, on a parlé du rôle des grandes banques dans l'établissement de taux d'intérêt pour des cartes de crédit dont elles sont émettrices, des taux qui sont parfois 20 à 30 Qu'est-ce que vous aimeriez voir de la part de ces grandes banques-là par rapport à des taux pour éviter que les Canadiens s'endettent encore davantage?
Bien, ce qu'on aimerait voir, c'est deux choses. La première, c'est ce à quoi on s'attend évidemment des grandes banques, c'est qu'elles respectent, et ça inclut le mouvement Desjardins, leur engagement de reporter à la fois les paiements d'intérêt et les paiements de capital pour les hypothèques. Les gens sont souvent pris à la gorge, n'ont pas les moyens de payer ce qu'ils paieraient normalement leur paiement d'hypothèque. La deuxième chose à laquelle on s'attend des banques et du mouvement Desjardins, c'est qu'elles continuent à non seulement être conscients et conscientes de la précarité de beaucoup de familles au Canada, mais qu'elles continuent à faire en sorte que leur mode de livraison de prêts, et ça inclut les prêts par carte de crédit, soit adapté à la situation actuelle. On sait très bien que les cartes de crédit, ça amène des taux d'intérêt très significatifs. Il y a beaucoup de gens qui, même en temps normal, auraient la difficulté à payer ces intérêts et ce capital. Donc, on s'attend à ce que les banques et le mouvement Desjardins fassent ce qu'elles ont dit au ministre des Finances, c'est-à-dire qu'elles offrent aux particuliers d'autres modalités de payer leurs prêts et de payer des intérêts plus faibles au cours des prochaines semaines et des prochains mois. Donc, on a entendu ce message des banques et du mouvement Desjardins et on a confiance et on croit que ce message va mené à des actions pratiques avec les familles et les particuliers à travers le pays.
Merci, Monsieur le ministre. One last question on the phone.
One last question.
Thank you. The next question is from Christy Kirkup from the Globe and Mail. Please go ahead. Votre ligne est ouverte.
Hi, good afternoon. Thanks again for doing this. My first question is for Dr. Tam. Right off the top, you mentioned specifically now cases within Inuit and First Nations communities, and I'm just wondering if you could please provide any more specifics on which communities you're talking about with confirmed cases or what regions of the country if you're not able to provide that level of detail.
Yeah, there's a number of communities. I mentioned yesterday that Nunavik, which is in the northern aspects of Quebec, had experienced their first case, and some large First Nation community in Ontario, and also, I believe, in some of the prairie provinces. So even one case in any of these communities is extremely serious. And the leadership in the communities have taken very rapid action in terms of some of those social distancing and restriction of movement measures within the community. And of course, colleagues from Indigenous Services Canada are in close touch to look at what needs there are. But and also as we are reporting, not necessarily specifically Indigenous communities, but the north of Canada. So Yukon and Northwest Territories both have cases. And so, and they are introduced into the community from travelers. And all of those, all the Northern Territories are taking very aggressive public health measures to try and prevent introduction, but also adapting what social distancing means in those communities, particularly where they have crowded living conditions, looking for alternative sites, for example, in managing their situation. And also the health system is also revving up to look after different patients, and having very close planning with provinces that are linked to them in terms of medical care and transportation. So all that planning is being done, but any single case in those communities, we have to really take it extremely seriously.
And just as a follow-up, the Indigenous file is a big part of the work that I do, and in speaking just in recent days to some leaders, for example, in Northern Ontario, I've heard that they have 0 test kits in some communities, and I'm just wondering, you know, if we can't figure out who has COVID-19, if there are no test kits available, how can we really get a handle on how widespread this is, and also treatment? I know testing is an issue in a number of different parts of the country, but it seems as though there is serious concern from leadership about their capacity to test at all.
Yeah, and they'll be linked to the bigger system of the provinces and territories as well. But I think there's absolutely a gap that we have to fill, because even the samples have to be flown vast distances to referral laboratories. So one of the priorities that we have right now, and we're evaluating some testing mechanisms where they can do that much closer to the patients. And so the National Microbiology Lab is now actually doing some of those tests on those kind of much more near-patient test kits that can be used. And that's actually happening right now, and we'll give you some more information as that progresses. But the goal, of course, is to then equip the territories or the more remote areas with their own capacity so they don't have to transfer specimens.
Thank you, Dr. Ceci met fin à la conférence de presse pour aujourd'hui. Thank you, everybody.
Je peux ajouter une chose, si je peux, concernant le Québec et la pénurie des masques, pour préciser, parce que c'est vraiment un enjeu que je comprends est urgent pour le Québec. Et je veux seulement souligner que hier, le Premier ministre a parlé, le Premier ministre Trudeau a parlé avec le Premier ministre Legault, que nous, le fédéral, nous comprenons qu'il y a vraiment une situation particulièrement urgente concernant les masques au Québec. La ministre en Inde est en train de travailler particulièrement sur cet enjeu, et nous comprenons que cette semaine, il y a une situation particulièrement urgent concernant les masques au Québec. Le Québec était très, très clair. Le Québec a une bonne communication avec le fédéral. Je veux remercier le Premier ministre Ford qui a aussi nous aidé en ce travail. Je veux seulement assurer les Québécois et les Québécoises que nous comprenons la situation, remercier le gouvernement du Québec pour la bonne communication et on est en train de la résoudre. Merci.
Thank you. The conference has now ended. Please disconnect your lines at this time, and we thank you for your participation. La conférence est maintenant terminée. Veuillez s'il vous plaît raccrocher votre ligne et nous vous remercions de votre participation.